Here is your stem. All right, so if you have read and understood, considering it surgical pathology station, please tell me what would be your provisional diagnosis?
Ma'am, according to this scenario,
Yes.
my provisional diagnosis is uh, septic. No, there is a fever, respiratory rate is high, rate is high. DIC.
All right, good. Okay. So please tell me the pathogenesis behind it.
As the patient has had a road traffic accident,
Yes.
and she also had her spleen removed.
Yes.
Moreover, there were bony fractures which were fixed, and she has been given a lot of blood.
Yes.
Uh,
Continue, please.
there is a possibility that she might be suffering from from a condition which is called disseminated intravascular coagulation. This
Okay.
is a pathological consumptive coagulopathy, which arises due to the activation of the coagulation and fibrinolytic systems,
Yes. Continue, please. That
and
leads to.
this system consumes clotting factors and platelets,
Yes.
and it is characterized with excessive hemorrhage, thrombocytopenia, deficiency of fibrinogen, and increased levels of fibrin degradation products.
Very good. So please tell me how these platelets are formed.
The platelets are formed from the bone marrow from megakaryocytes.
What exactly is the function of these platelets?
The platelets helps in coagulation system in two different ways. First of all, it helps by adhesive and cohesive mechanism. Secondly, it initiates coagulation pathway.
Okay. Please tell me how. All right. Okay. You've already. Please tell me why is it important for you to know that the patient is a known case of hepatitis C?
Because this is a risk factor for this patient to develop disseminated intravascular coagulation.
And what else? Why do you think it would
Uh,
affect
because
or
of
patient's recovery?
infected hepatitis C virus, there is a possibility that this patient might be suffering from cirrhosis
Okay.
or
Yes.
hepatocellular carcinoma.
And then this would affect the formation of
Formation of
what
clotting
are the
factor.
yes, what are the clotting factors which are formed from the liver
Uh,
or which are
uh,
dependent on the liver?
the clotting factors which are activated by the vitamin K, for example, clotting factor 2, 7, 9, and 10.
Okay. Right. And this could also lead to the bleeding tendency of the patient as well.
Yes.
And splenectomy has already been done and hepatitis, so bleeding tendency would be there. So what happens when there is a bleeding or there is injury of the endothelial wall?
When there is such an injury, there is a the two coagulation pathways, which are intrinsic and extrinsic pathways,
Yes.
they are actually initiated.
Which one would be initiated first? Extrinsic or intrinsic?
Whenever there is a vascular injury, the collagen in the vessels are exposed, and it leads to the initiation of intrinsic pathway. Whenever there is a there is cell damage or tissue damage, the
Yes.
extrinsic pathway is initiated.
Good. How would you confirm or how would you test extrinsic pathway?
Extrinsic pathway is tested by uh, activated partial thromboplastin time.
Prothrombin time. Extrinsic. Intrinsic is APTT. All right. Okay. Please tell me if you do not get to or if you cannot arrange the total blood, how or what other products can you transfuse to the patient meanwhile?
If we are unable to provide him the blood, we
Yes.
can give this patient plasma expanders. For example, crystalloids, colloids,
Okay.
crystalloids and colloids.
Why would you not consider giving packed red blood cells to the patient?
Uh, we we can give packed red blood cells to this patient.
Yes. How
We
much? Yes.
basically he is suffering from a condition in which coagulation and fibrinolytic systems both are activated, and
Yes.
according to the massive hemorrhage, according to the massive transfusion protocol, we have to give this patient red blood cells, plasma, along with fresh frozen plasma, along with cryoprecipitate.
Which cross-matching test can be done?
We have to do ABO and RH group cross matching for this
Before
patient.
transfusion. Otherwise, what are the different hypersensitivity reactions that can occur?
There are 5 types of hypersensitivity reactions.
Very good. Please tell.
Uh, the type 1 hypersensitivity reaction, which is called anaphylaxis, this occurs due to exogenous source. This
Yes.
is initiated due to exogenous source, and uh, asthma and hay fever are examples of this type of hypersensitivity. Type 2 hypersensitivity is cell mediated from the
Yes.
cell surface, and there is its source is internal, and uh, uh, autoimmune hemolytic anemia and good pasture syndrome are the examples of type 2 hypersensitivity. Type 3 hypersensitivity is due to the immune complex. It is immune complex mediated, and uh, uh, immune complex mediated SLE. Uh,
Lupus. Yes.
Frequent
Yes.
are the examples.
Yes. All right.
Type
Please,
of
last question. What is antigen in cross-matching?
antigen basically in cross matching, antigens are found which we test antigens in the donor on in the donor red blood cells. These these can act like a foreign body if it goes into the recipient blood, and it can cause a severe immune reaction.
Good. Thank you so much. Wonderful. Okay, my last question, please. What is the criteria to move or transfer the patient to ITU? Intensive? Yes.
In this patient,
Critical.
if the bleeding is unable to control,
All right. And
and if the patient needs monitoring,
yes, one-to-one monitoring. Yes. And the more important one. After surgery and one or more organs are failing.
yes, and
Thank
there is
you.
multiple.
Yes.